Hi, my name is Claire Schwegel. I'm the Director of Nursing Content at Board Vitals, and I'm here with Dr. Harry Cho, the Chief Value Officer for New York Health and Hospitals. I just want to say thank you, Dr. Cho, for taking the time out of your day to answer some questions for us and give us a little insight in our community, some insight into what's going on related to COVID-19.
Well, thank you so much for having me. And this is a privilege being here, and I really appreciate the support, the financial support that you've been giving to New York City Health and Hospitals.
Our users, for every Board Vitals purchase that is made now in the near future, $5 is being donated to New York Health and Hospitals. So we're really committed to that cause and giving back to our community. On that note, let's take it away with some questions. So as everybody knows, social distancing is sort of the hot topic these days. Other than social distancing, from your experience and what you've seen recently, what is the best way for the general public to help with the coronavirus pandemic?
Sure. So the basics, besides social distancing, is obviously just making sure that you wash hands. It's a very important thing. It's tried and true and it's proven to wash your hands, but whenever you can and before, and definitely try not to touch your face because the transmission is mostly through droplets.
Great, thank you so much. So Board Vitals, along with many other people in New York City, around the world, are really trying to do their best to donate masks, donate money to help all of our healthcare providers and help patients who are sick. How are the funds that are donated to New York City Health and Hospitals COVID-19 relief efforts going to be used? And how does that directly impact you and your patient care?
Sure. So in general, I would say the funding that's been donated, and we really appreciate it. I think right now, most of it is going to be towards supporting our staff who are on the front lines. If you can imagine, they're sort of working on overtime and overdrive and just trying to do the best they can in the situation for this disaster. And so they're working hard, and they just need the support in terms of everything that's going on here. So restaurants are closed, grocery stores are hard to get to, even during the daytime hours when they're in the hospital. It's hard for them to actually get the stuff that they need. And so a lot of this is for food and just sort of supplies that they have, just so that they can come to work and just not have to worry about all of that. I would say that's probably it. I think the next thing right now, as the numbers are starting to plateau, I don't want to jinx it, but starting to plateau and go down in terms of hospitalizations and deaths, and especially the ICUs, is we're trying to support our staff members, because everyone has been on an adrenaline rush right now. It's sort of they've come forward for the call, and they've really courageously have done so. But I think after everything is said and done, now we're just taking a moment, and now we're looking around, and it's our own staff members that are sick, that have been hospitalized. I think you've sort of heard that some staff members have died. And so a lot of this is just trying to get grips with the reality and just trying to cope with it too. And trying to think about the next steps. And so we need some support around that also.
That sounds so stressful for families, for patients, for nurses and doctors. How has your staff been coping with it? What are some of the things that you've seen been happening? I know that there's a lot going on in the New York City area with the 7 o'clock clapping and the appreciation hour. What have you seen, at New York City Health and Hospitals?
Sure. Well, I could start with my staff, both from administration and also just in the front lines too, over at Bellevue, which is where I rotated last and did some clinical. I would say it's tough. It's tough. It's for myself personally and for my own close team. I think it's been going from 6 to midnight for I don't know how long. It's just been, and they've been tremendous in sort of mobilizing to try and support in whatever ways they can. It's amazing how people just kind of put, just come for the call. And, there is no such thing as weekends or nights anymore. I think it's just everyone just knows that this is a dire situation and we just need to do what we can. For coping, I think it's hard because, and I think you're seeing it too, being cooped up at home whenever you can do work from home, that's not a great thing just overall in terms of just anything, just in terms of mental health. just being able to interact and just do work in general. I think a lot of this is done over the phone, sometimes by video, but the communication is choppy at best. You know, and you want to have these sort of brainstorming sessions about what to do next, and it's hard to do that over phone calls. It's the awkward silences and the pauses. But besides all that, I think also just motivating each other to keep going. This is not easy for anyone, including people on the front lines. They want to support our patients. They want to do the best they can because they are ill, they are in the room, and they are, you know, they need all the help they can get, and then coming home to it, to your own families, to your kids, and then all the extended family that you have that you want to call just to make sure. I know personally, later, I try to call my mom as much as she can. She's at home alone in California in the suburbs. And again, it's probably okay. She's one of the least sort of risk in terms of people around her and the proximity to all this. But again, it's worrisome. It's just your family all around. So I think this is hard. And I do want to say also, the more I speak with leaders and staff members and everything else, I think most of our jobs is trying to stay positive, trying to lead in the best ways. I think someone sort of put it really nicely. She said, over half of my job is trying to be positive and counsel and motivate people just to make sure that they're okay so they can do the job to take care of our patients. So it says a lot about that.
Definitely. I know that our governor and a lot of the businesses around town have been really trying to also go out of their way to make the situation at least a little bit easier. Have you seen support from your community? Is that something that really is affecting you? How about with regards to donating supplies and materials to the hospital? Is that something that's felt? And, what are your thoughts on that?
Yeah. So New Yorkers, I think in general, are just tremendous. I think they've been through 9/11. I know that how much they sort of supported each other and came together for that awful event. And I think we're seeing the same things. I think a lot of people are just really figuring out how they can support each other, how they can help each other. And it's really heartfelt. The number of people that have been trying to help in terms of PPEs, whatever little they have or however much they have in terms of funding and donations, and the restaurants just calling. The last time I was over I walked through a conference room or something where the medical staff go through, and on there is a number of a pizza place, or it says, if you guys need food, call this number and we'll deliver for free. And it's really nice to see that, because it is hard, but just that sort of feeling of togetherness, I think is tremendous.
That's really heartwarming to hear. What do you think is the most common misconception about COVID-19 these days? I know that there's been a lot, of misinformation that's been spread about it, and getting really your opinion and the medical community's opinion is very valuable.
I would say a couple things. One is that it is incredibly important, and this is very dangerous. That's a very simple way to say it, but I know that there are still people around the country that just go outside and feel like they're a little bit invulnerable to this whole process. It's not the case. I think you've seen sort of people reach out as healthcare workers on the front lines. They are exposing themselves each and every day. This is not going to end very shortly. And so just for the frontline staff who have to face this no matter what, every time you go out and you expose it and then you come back home and you expose your family or your distant family or whoever is in the building or your neighbors and things like that, that is a huge risk. It's not just you, it's other people around you. And so if you think about that, it puts things into a lot of perspective. So I would say that's a common misperception. The second one is that this is a long haul. It's not a short sprint. It's not like a flu season that we're just going to get over within a month or two. This is quite a big deal that we're going to have to work together through for months moving forward. It's hard to understand the projections of this and how we mobilize because everything will change by the day, by the week moving forward, depending on how much testing we have. So the different states are going to come up with different plans, but just working together for this. I know it's tough being cooped up at home. I know it's tough not being able to see your family, in a different state and not being able to travel and all those things. But this is a long haul, and we just have to work together for a long time.
Speaking of working together, have you had the opportunity to work with healthcare professionals that have maybe flown in from other states or cities to support the fight here in New York City?
Oh my gosh, they are so welcomed. I gotta say, so I was in during this time whenever they've always volunteered, but I think there was a large sort of wave that came, I think maybe a few weeks ago when I was on service, and it was incredibly helpful because if you can understand, the staff that we have now have been just going on overtime over and over again, and they've seen their colleague, to the left and to the right, who gets sick and had to stay home or get hospitalized, and so it's exhausting. But here come these volunteers who honestly, I don't think, it's just like, they didn't even have a specific, they just said, I want to come in, I want to help, get me in somewhere. And so I would just, every day it would be different volunteers who come in. And one I remember was a PA coming from Wisconsin, and she was a surgical PA, and I was on a medicine service, and I was like, great, let's work together. And we were just figuring out together how to manage DKA without having to go into a room as often to do the finger sticks as frequently. And so all of this is just very rewarding. It's very refreshing. The military coming, I think, with their clinical staff has been incredible, just in terms of support, and just having sort of support staff just all around us, I think has been helpful. And again, I think this is going to keep continuing. And it's really refreshing to see our medical community just step up. They're not asking for money. They're not asking for much. They just need a place to stay, and they just want to get in there. And it's just incredible to see that.
How has the unfolding of sort of how the health system has, taken on these changes, has the situation in hospitals, really scaled up significantly from the start, from a few weeks ago? How are they making these changes to deal with now the influx of patients and requirements given your resources?
It's a good question. I think it's honestly hour by hour and day by day. It is incredible. You can't plan for something like this. You can sort of guesstimate, but honestly, things have changed so much since we first started mobilizing for this. And as it came, and the first cases, and how we dealt with the first cases, to the different policies that changed by the day from our city, from our state, from our national sort of colleagues, I think has been very tough in a lot of ways. It's helpful, it's tough, it's just hard to get adjusted to. So even things like PPE measures and how we treat the infection, and how do we test for infection too, or if we can't get the test, then how do we presumptively treat, and how do we presumptively take care of our patients, has changed literally by the hour during this whole process. And if you can imagine this, again, if it was everyone was in the hospitals and we were just meeting and sort of collaborating on a spot, it would be so much easier. But again, a lot of us are separated, so it'd be these awkward sort of phone calls and trying to manage those. But it has been tremendous. I've seen people step up and just shine in ways that I just didn't imagine. For one, as I'm rotating in Bellevue Hospital, it's amazing to see their leadership, and people just who really haven't been in the leadership position just kind of step up and help each other and communicate this, from the first thing in the morning to town hall meetings to the last email at night, just wishing everyone and thanking everyone. All this has been incredible. And that's been very rewarding in process.
Besides doctors and nurses, can you tell us what other hospital employees that are on the front lines that the general public may not be aware are there?
Oh, the maintenance staff. I don't know how you can do this without them. And unfortunately, they're just not they're just not sort of seen as the sort of the classic essential sort of staff in a lot of ways. But you can't do this. The infection control process just does not function without them. It's not just, you have to worry about every single thing within the room that's been exposed, to the curtains that divide patients up, to everything, doorknobs, and how frequently, and everything else. And so in order to sort of move things, if the ED gets overflowed, and there's no room there. It is incredibly important how quickly we sort of stabilize patients, get them home, and then get that room ready so that we don't expose other people, other patients and staff, in order to decant the ED so that we can actually give them a little bit more room. They're incredibly helpful, and I think we just don't recognize because they're not a part of our daily rounds when we talk about clinical stuff, but they are incredibly helpful there. And then you mentioned the respiratory techs. One of the things that's, again, I think this is a lot of just how can we help our patients? And so when they're short of breath, sometimes people throw in or order things like albuterol inhalers just to help their bronchospasms, but sometimes it helps, a lot of times it doesn't. But and just respiratory staff come in and sort of adjust the oxygen, the BiPAP, the albuterol, and things like that. And that's aerosolization. It's high risk, and they're just going in there, sort of on the front lines, literally just doing that over and over again. And I do sort of, this is very different from also just physicians. I know, in general, we see our patients once a day for that small period. And we're not doing the oxygen, we're not adjusting a lot of these things. And so that are much higher risk. And so I really applaud their work.
It sounds like, you're functioning in a system where people are really jumping up to help with the cause, and doing it in an environment that you might be short of staff, short of resources, PPE. What kind of innovation, what measures have you seen that, your respiratory therapists, your nurses, doctors, anybody that's involved in patient care have been taking to kind of improvise, given that the health systems have been dealing with being a little bit overwhelmed by COVID-19?
Yeah, this is so, it's interesting. And I don't think anyone has the right answer. It's always a risk. It's always a weighing of pros and cons, the risks and benefits to both the patient and the staff, and exposing each other and supplies and things like that. It's always tough. I would say, from the get-go, I think it's just, in terms of how, so for example, in the very beginning, the tests and the different labs and the turnaround times in terms of when these tests came back, whether someone had COVID or not, varies. I think ideally you want this to happen within a couple hours, but it doesn't. Sometimes it takes days to 5 days or more. And so you can imagine trying to sort of mobilize for this and trying to test or treat empirically if they had COVID, depending on the prevalence of COVID in the hospital at one time. All of this has been very challenging. Things about, I think a lot of people think about things like X-rays and CAT scans and things like that. Every time you take someone to the CAT scanner, that's people who are gowning up to transport the patient, exposing people in the hallway, in the elevator, and the radiology room. And then there's an aeration process to make sure that that's safe for the next patient. That's a big deal. And so, when you don't have that accurate test that's immediate, again, what can you do to best sort of diagnose and treat the patient with the surroundings that you have? The X-ray, ideally what you want is a really good X-ray where you send them down to the radiology room, you do a front side and a lateral side, and you want that information. But given the circumstances, again, a portable may be the best way, plus some parameters in the labs. And so a lot of this is sort of work and play, and different institutions have them. And we're still trying to, tweak these as we go, as we have more information. So it's a lot of interesting scenarios like this. The other one that I mentioned to you was diabetic ketoacidosis. It's usually done in the ICU setting with a finger stick of checking your glucose by the hour and adjusting the insulin regimen. But given this whole state, ICUs are packed. And we need them for ICU. We need the ICU staffing and the ICU monitoring for respiratory failure. So people who are mechanically ventilated. And so, and again, just kind of asking staff to go in every hour to get that finger stick monitoring is tough. It's PPE every time. It's regowning and doing everything and just exposing other people. And so trying to, think of other ways to best control patients and their sugars during this time with sort of pushes instead of the drip. It's been interesting. It's been interesting.
You mentioned that it's been incredibly hard for the patients' families and being separated from their loved ones when they're hospitalized. What is it like for families of healthcare workers?
Yeah, it's tough. So I would say it makes, I would say the people that I've spoken with, the families are home. They're worried about obviously their loved one going off to the hospitals, given this sort of dangerous pandemic that's going around. It's that sort of worry, plus the worry of, you know, if you are the husband sitting at home and your wife is a physician and then they come home, it's the kids that are sitting at home. How, are you going to expose them? What's the risk? What do we have to do to prevent this from happening? Plus just the fear of the asymptomatic spread, all of that. So it's just hard to sort of gauge. But they come, you know, and then they come home, and also this just, you know, it's not, here's work, here's the pandemic, it ends as soon as I come home and I relax. It's not, it's constant. It's what families talk about over and over. It's what's on the news. You just can't get away from it. So it's nonstop in that way. And then, you know, I do know healthcare workers that, you know, have stayed at a hotel for, you know, during the time when they're in the hospital just to not expose their family. The FaceTime, if they try and communicate because they're separated. You know, one of one of our sort of VPs in our department, he just had his kid, and he as soon as this hit, he had to separate himself and just stay in the basement and not sort of physically interact with the kids. And this is just not the most ideal. It's a little bit tragic, but I think it showed us tremendous sort of resilience and willpower of everyone trying to step up to the plate.
How has working on the front lines affected your personal life? Can you share a little bit with us about what it's like coming home for you?
Sure. I may not be the best example. You know, I'm not married and I don't have kids. So for me, this is just kind of status. I don't have to worry about exposing anyone in the home. But for me, it has been, I think it's a lot of the same things that you're sort of facing. One is my family members that I'm worried about, you know, just making sure I call my mother just to make sure that she's okay. The other thing that's sort of come up is because this is, the virus was sort of first exposed over in China. And so there's this sort of Asian stereotype and this sort of, you know, that sort of stigma that comes with it. And so she's South Korean, and I am terrified from day to day of her going outside. I want her to walk. I want her to sort of get out there because she's cooped up by herself. But each time there's this part of me as a son who's just worried that she's going to get, someone's going to yell at her or attack her or things like that. And so those kind of things really worry me. And then just, you know, I think with everyone else, you just need that social group where you can sort of support each other. And unfortunately for work, every time you interact with people, there's always, you know, you do the work, but then in between the meetings for the 2 or 3 minutes, you sort of chit chat about how your day was, how your weekend and stuff. These conference calls are not like that. And so if you're not physically with them, if you can't see their faces, that interaction doesn't happen as often. So those kind of things just make your sort of usual social supports off. And then, you know, on the weekends when you do want to sort of chat with your friends, is sort of doing it over FaceTime if you can. You know, it's not the most ideal. But again, this is nothing compared to, I think, the families with, you know, my colleagues with wives and husbands at home and their families and kids, and, you know, that have to go through that process.
Absolutely. Speaking about social support, what does the 7 p.m. clap mean for you? Have you had the opportunity to participate in it or witness it firsthand?
Yeah, no, this is a good question. So it's been nonstop for myself and my own staff. I would say the one time that I actually enjoyed it, first of all, it's incredibly helpful. Keep it up, because I think our staff, our healthcare workers, our frontline essential staff just need it. It is a word of encouragement. It's like the city coming together, knowing that this is going on and we support you. So keep doing that. I'd say I sort of hear it in the periphery as I'm doing work and things like that. But the one day was, I think it was about 9 days ago when it was my birthday. And so I just said, you know what, I just need a minute. Let me just go out there and just enjoy it just for a little bit. It is uplifting. Sometimes I do have tears coming out of my eyes during this whole pandemic, because it was very tough from day to day without rest. And so it's incredibly uplifting. People do take it to heart. It's important.
So is there anything else you want to share with our audience, medical students, nursing students? I don't know if you've had the chance to interact with any of the early grad med students, but I know a lot of new providers are out there helping you and you know, championing this cause.
There's a couple things that I would share with them. I would say for the amount of support and willingness to help, I think, from our student colleagues has been tremendous. Our medical students who were asked to stay home, I know a lot of them did not want to stay home. They wanted to be there. They want to be on the front lines, and they are figuring out every single way they can to support. Our staff and our patients in the hospitals has been incredible to just figuring out how we can help with the PPE process, to getting more volunteers, to make phone calls, to help update our families whenever our staff is sort of overwhelmed. All those things are incredibly helpful, and keep that up. I know that there's also in New York that there is also a group of medical students who are fourth years who graduated early are now sort of stepping up to the plate and want to come into the hospitals. I wish you the best of luck. It's incredibly needed. It's also very scary. We're here with you, and we'll go through this together. But it hasn't gone unnoticed, and it's deeply appreciated. And I would say for just students in general in the healthcare field, I'd say this is exactly what we're preparing for. It's sort of our, a lot of how we get through this huge pandemic. This is just once in a lifetime unfortunate thing that we as a society have to get through together. Healthcare workers are at the front of this. This is a tremendous time for you to sort of view this, and just this is what you do here, what you do in the front lines, and what you do just in terms of just helping out and figuring out the next phase of this is really important, and it matters. I cannot tell you that. And I do want to just reach out to the students and other workers that just have been trying to help like every little bit during this pandemic, during that hour, during that day when it was the worst. It really did make a lot of difference. And sometimes as first students, it's a little hard to see that sometimes, but it did. And I want to let you know that.
Thank you so much for answering our questions and for your kind words. It really has a huge impact on all the nurses and med students and doctors that are studying and using Board Vitals.
Thank you.